Hello and welcome. Hello and welcome. We'll be starting in just a few moments. Good evening. Welcome to Hormone Happy Hour. We'd like to thank you all for joining us tonight. I hope you have, since it's Hormone Happy Hour, do you have your cocktail? It's time to have a little vino. So thank you for joining us today as we learn about hormones, why we can't live with them, and why we can't live without them. To share a little bit with you about Individualized Health Experience 360 with Murrmann. It's a Center for Wellness for Health and the Center for Laser and Aesthetics, and it embraces a full whole person 360-degree approach for each individual that includes both total body wellness for the personal experience to make sure that you have a positive difference in patients' life and that each one of the doctors and nurses are making that positive difference in your life. So I want you to meet the doctors. Dr. Mary McDonald, she's the co-founder of Murrmann Women's Clinic and graduated from the University of Tennessee in Knoxville and the University of Tennessee Health Science Center. Also, Dr. Susan Murrmann, they both co-founded this over 20 years ago, wherein Dr. Murrmann graduated with honors from Bradley University and Rosalind Franklin School of Medicine, which was formerly Chicago Medical School. And then Dr. Heather Donato, she joined Murrmann Women's Clinic in 2003 and graduated from Vanderbilt University and also the University of Tennessee College of Medicine. We also want to share with you a little bit about the Center for Laser and Aesthetics. A little bit about the Center for Laser and Aesthetics, co-founded by Sarah Carpenter. The Murrmann Center for Laser and Aesthetics. I've already been drinking my wine, a little bit of aesthetics. So, the Murrmann for Laser and Aesthetics offers non-invasive and minimally invasive treatments as well as anti-aging therapies to enhance both men and women to make sure they feel and look the best they possibly can and also complete the 360-degree circle of health. Murrmann also has new and innovative therapies to help you with your life. 360 degrees. It's all about how you can be the best you. Between bioidentical hormone therapy, including pellets and compounding for both men and women, anti-aging and immune boosting IV therapies. So if you get that hangover, you know what? You can get a little help from your friends. In-office 3D mammograms, vaginal rejuvenation options, including home treatments. And I'm sure Dr. Murrmann will share a little more about that fun little bit of information later. New skin tightening devices, hair growth treatments, medical grade supplements, diet nutrition options, and state-of-the-art fillers and injections for facial rejuvenation. Body contouring, we also can take and help you with to help you look and feel your best. So remember, for more information, you can visit our website at www.mmcwh360.com. So now it's my great pleasure to introduce to you the Rock Doc, the Dr. Susan Murrmann, the co-founder of Murrmann Center for Wellness and Health and Murrmann Center for Laser and Aesthetics. Dr. Murrmann is continually learning and working to stay abreast of all the medical advancements. Dr. Murrmann encourages women to have great care of themselves, to take great care of themselves inside and out, and believes medicine should be about practicing prevention instead of intervention. She's a big proponent of making sure her patients are inquisitive and informed as much as possible about their own health. She specializes in bioidentical hormone and pellet therapy, anti-aging, functional and peptide medicine, expert in minimally invasive surgical procedures, gel point, single-site surgery for fibroids, pelvic pain, and abdominal bleeding. Vaginal rejuvenation, she's an expert through Thermova, CO2 Lift-V, VFit, O-Shot, PRP rejuvenation, and as well as aesthetics gynecology, including labiaplasty. In-office liposuction, fat transfer, minimally invasive abdominoplasty. Lord, that's hard to say, Dr. Murrmann. Certified in fasting, nutrition, and longevity medicine, hormone imbalances in young women. Dr. Murrmann can take care of you 360 degrees, your whole health, who you want to be, where you want to be, and to be the best person you possibly can be. So, Dr. Murrmann, it's over to you.
Well, thank you very much for that great Production. I really appreciate it. Cheers to everyone to Hormone Happy Hour. We're so excited to be here. This is our very first inaugural webinar, and we plan to have many more depending on the response. But we think we have a great show coming up for you tonight, and please enjoy it. And we'll start right now. So hormones. I always used to say that hormones sometimes are just like men. You can't live with them and you can't live without them. When you can't live with them, a lot of times that's perimenopause. When you can't live without them, that's menopause, because basically you have no hormones. And just, it's sort of like an old actor, Shakespeare said something like that. So hormones, I kind of made this into like a movie because it sort of is. It's a progression of life and it happens, and we just need to tell the story. So we have the cast starring estrogen, progesterone, and testosterone. We have a supporting cast because there are other hormones too that we all need to be aware about, and that's thyroid and cortisol. So when we talk about estrogen, it's just not one estrogen. There are 3 different estrogens that we have in our body. Estradiol, the main dominant hormone, I like to call the good witch. It goes all around your body into the different receptors and really makes you feel a lot better. It stops the hot flashes. It helps your skin. It has all sorts of good actions in the body. Then there's estriol. It's one of the weakest hormones. However, it's the younger sister, and it has a lot of benefits as well. So a lot of times a blend, the 2 sisters are actually very good. Estrone is now the evil stepsister. It used to be that we replaced hormones called triest with a lot of estriol, estradiol, and estrone. But now we know that estrone itself can go down a bad pathway, sort of like most evil stepsisters do. And they end up going down a bad pathway that could turn into a precancerous situation. So we want to stay away from estrone, like everyone wants to stay away from their evil sister. Progesterone is the peacemaker of all the hormones. It is the antithesis of estradiol, and the balance between the 2 is very, very important. You'll see as we play on with our story with hormones. Testosterone, I like to call the good fairy. We all need a little ding from our magic wand on testosterone, because we have in our bodies 1/10 of the testosterone that men have. But it's very important. A lot of women think, oh, that's the men's hormone. Well, it's not. Men have estrogen, not like we do, but we have testosterone, not like they do. So thyroid and cortisol are also the other hormones that we'll talk about a little bit later on. So when we go to the plots that occur throughout life, we have perimenopause. I like to call that the roller coaster ride. It's like called premenopausal, but it's puberty all over again, when your hormones are generally all across the board. They're up, they're down. They're causing all sorts of symptoms like hot flashes, fatigue, mood swings, weight gain, anxiety, skin changes, decreased vaginal moisture. But then again, they could go away in a heartbeat. The increased wrinkles, and the plot thickens. And women that are going through puberty, it's a lot of acne. It's a lot of mood swings. Like I'm sure my family would attest to that when I was growing up. Menopause, it's really the end, only if you want it to be. It means there's lack of hormones. No period for over a year. I debate that. I mean, I think the average is no period over a year, but I've actually seen women come in to me after 2 years. They're very young, in their late 40s, and they start their periods all over again, and their hormones are like that of a teenager. So although it is a rule, it's not a steadfast rule. But it's the only silver lining when we have no hormones, because we only have one way to go from that way up and make you feel a lot better. Symptoms of menopause, I mean, they vary from women to women all across the board. Lack of sleep, hot flashes, fatigue, joint pain. A lot of women don't believe that joint pain can be caused by fatigue, but I saw another patient today that said the same thing that I felt and experienced was I'd get out of bed and the bottom of my feet hurt. And things can really happen like that. Lack of sex drive is a big deal. Depression, painful intercourse, and we can go on and on with all the different symptoms. So what happens? Part 1, we're going to talk about the happy years, your hormones at every age. So like I was mentioning, in your puberties to up into your 20s, your hormones are still trying to figure themselves out. Some girls go straight into their hormones and have periods like clockwork. Others might miss their periods. A lot of acne is going on, a lot of angst. Patients are bringing their children to me, or their teenagers. Her mood swings are horrible. So the hormones going up and down can really cause havoc on the hormones and their mood swings. In the 20s and 30s, you're sort of stable out, except for a few, and I'll speak about that a little bit later on. But you pretty much stable out with your hormones. Now, 40s is another thing. It's the wild card year. Anything can happen. You could stop your periods. You could have more frequent periods. You have the mood swings all over again. Some women have acne. It's like reliving puberty all again, and that's what they're telling me. Fatigue, hot flashes, and then that can change on a dime. You could be going back to totally normal periods and normal mood swings, or not. Well, no mood swing is normal, but it happens. But you could go back to your normal self, and every individual is different. And what ends up happening is they're feeling good, then they're not feeling good, and they're coming back to me and they're not feeling good, and then they are feeling good. So you have to really watch what you're doing and try to treat the symptoms, but keep a close eye on them, because it could change at a dime. So part 2, the main character, estradiol or estrogen, tries to act up. In every movie you look at, part 2 is always the worst. Everything's going great, then all of a sudden something happens, and everything takes a downward spiral. So it takes you on a roller coaster ride. Progesterone, the peacemaker, actually gets sidelined in this process. It goes down, estrogen goes up, breast tenderness, mood swings, weight gain, fatigue, hot flashes, abnormal periods, and a host of other symptoms can happen with this. The other problem that the main character gets into, which I was alluding to before, and this happens mainly in the earlier years, is polycystic ovarian syndrome, fibroid tumors, endometriosis, and menstrual migraines. Estrogen dominance, meaning estrogen trying to beat everybody else out and get to the higher numbers, is causing all these syndromes, which can cause different problems. Pelvic pain, fibroid tumors tend to grow. Migraines will happen because your estrogen is up, then it's down. So those mainly happen in the young years, but suddenly tend to worsen in your 40s. What are the accomplices in all this? Well, I know patients are tired of me talking about diet, but I'm a firm believer that diet is one of the biggest things that you can do to take care of yourself when you're having these issues with hormones. And a lot of women don't realize you get estrogen dominance a lot of times from your own body, but you also get it from what you're eating. Foods cooked in bad oils like peanut oil and other canola oil are also not good. You get dairy products with hormones in them. You get red meat that contains a lot of hormones. Some chicken contain a lot of hormones. You also get, if you're microwaving your food a lot, you're getting these xenoestrogens, meaning fake estrogens that are feeding your body. And so we have to be really careful what we eat, what we're putting into our bodies. And also that estrogen, once it gets into your body and it's an abnormal form, gets processed into those abnormal forms of estrogen called estrone in your liver. And what also happens too, it stores in your fat tissue. So you're constantly secreting these estrogens into your body. They're coming from your fat tissue. The environment, like the plastics I was telling you about, is very, very important to watch. That's why we don't have BPA in our cans anymore, in our plastic bottles, because that turns into a xenoestrogen. We're inhaling this, what's ever going on in the atmosphere that we're breathing in. Our water supplies can be contaminated. So we just have to be real careful. I always tell my patients, please, please, please purify your water. I know you think Memphis has the best water system, but there are a lot of impurities that we're just not checking on it. So I recommend filtering all your water, especially if you're cooking or you're drinking it. Stress can really mess with your hormones. And this goes back to cortisol. Cortisol, I call it, and I'll tell you about it later, it's the bipolar hormone. It's up in the morning, it's down at night. But a lot of times it's up all the time because of your stress. And when that happens, that actually can mess with your hormones. It can mess with estrogen levels and testosterone levels. So stress is a big role. So trying to decrease your stress in your life. I know it's stressful right now because of our viral situation going on, but find a way. like exercise, to really decrease your stress levels. Weight gain, another huge thing. I know we always say I'm gaining weight in my 40s. Well, it's a combination of a lot of things that are going on, but it's also your body's not processing some of the foods like starch. I tell people that, they've been eating bagels every morning. I say, well, you might as well just apply those bagels to your belly, because that's where it's going to end up happening. So you have to watch out for starch, because that turns into sugar, and sugar turns into fat unless you're actually working it off. And it also goes to your brain and can be contributing to a lot of sugar, and they call Alzheimer's the type 3 diabetes. So weight gain also will contribute to a lot of your hormones being stored in your fat tissue. And that a lot of times starts circulating later on in life, and you can get your periods back after you think you've been in menopause. What do we do? Some of the props that we use to test for blood work. First of all, I think the best thing to do is get a good history of your patients. And I try to ask them all sorts of questions and find out what they're going through, because that will sometimes give you a clue. And I don't even have to check the hormones to tell you what's going on. But we also like to do blood work. Blood work can give you a snapshot of what is going on at that particular time in your blood work as far as your hormones. It might not tell the whole story of what's going on in your cycle, and it depends on what time of the cycle that you're actually testing your hormones. But you want to make sure that you can just get a snapshot. And sometimes by looking at an FSH and an estradiol, I can tell you what's going on. We're looking at a free and total testosterone as well, and a particular binding globulin called SHBG. Those really can give you a good idea of what's going on, but you need to sometimes look at timing in your cycle. Saliva testing is good and really, I think, works a lot of times if you're doing testing throughout the day and getting a curve of cortisol, or you're getting DHEA, or you're looking at estradiol, that's a topical estradiol, can give you progesterone and testosterone sometimes. So there's a lot to be said about saliva, but sometimes you really have to prepare. You have to be well hydrated. You have to chew some gum. You have to do something before you do the saliva test, or a lot of times it can be inaccurate. So, there's back to Shakespeare again, taming of the shrew. How are we going to fix the problem with estrogen trying to dominate everybody at this time of our lives? So a lot of times women are not symptomatic at all. So we can observe and just watch what happens. You don't have to jump in right away and give hormones, but you can watch and see what's happening. You can take DIM, or we have here, it's called estrofactors. And it's DIM with some other herbs that actually will help metabolize some of that excess estrogen and excrete it through the urine, or through the metabolize it through your liver. We also can recommend a natural progesterone. Sometimes this tames the shrew. It gets estrogen and balances it out. And depending on some of your symptoms, you could take it 14 days out of the month, 21 days out of the month, or 25 days out of the month, trying to maintain a cycle, but downplaying the estrogen that you're getting. So natural progesterone is always our goal. It can be topical, or it can actually be in an oral capsule. So we want to revive that peacemaker. Low dose estrogen therapy, some women need it. Their estrogen levels are low, although they spike sometimes, but a low dose estrogen therapy along with a natural progesterone can help. Now, if you've had a hysterectomy, that's a different story. Some women don't have to take the progesterone, but it does help balance, if they still have their ovaries, the very, very high estrogen levels. All right, part 3, menopause. It's actually the finale. Estrogen and progesterone have left for dead. In other words, they've left the building like Elvis. Testosterone continues to dwindle. No periods for at least a year, so they say. This is when more symptoms come into play. Difficulty sleeping, hot flashes every day and every night, fatigue, weight gain, vaginal dryness, painful intercourse gets worse, and then, of course, there's lack of a sex drive. Of course, there's more symptoms than that, and everybody experiences it different. But I say we only have one way to go from there, and that's up, because we can actually, when you're at ground zero with hormones, that is a better way of treating you as opposed to trying to play a guessing game with perimenopause. So let's check in with what some non-hormonal treatments are. It depends on the symptoms. Sometimes hot flashes. You want to avoid triggers like red wine and spicy foods. There's herbal relief. You can do Estrovera, which actually is a combination of herbs that we have here at the office that actually help. And we have several of our employees on Estrovera, and they say it really works when it comes to hot flashes and they don't want to take hormones. Black cohosh is great. Before I get to Ambrin, that's the one they advertise, I think, on the radio. There's also some physicians will prescribe Effexor or Paxil, which is a serotonin reuptake inhibitor to help you with your symptoms. I would rather treat somebody naturally than jump to an antidepressant type deal, because then they're hard to get off. Two, they can cause weight gain, and sometimes they just kind of make you feel flat. Now, there's also meditation, there's yoga, exercise, all sorts of things that you can do to help with your symptoms. And a good attitude, a positive attitude always works. Now, Ambrin is something that they actually, I've heard suggesting on the radio for people to take, and I'm sure, sorry about that. You can call a number and they could send you samples, but I Googled what was in it. They do have some good actually components to it, like magnesium and zinc, but they also have MSG in it. And I don't know if you knew that, and I didn't know that. And MSG is something that you don't want to take. It's a preservative. It crosses the blood-brain barrier. It actually can elicit seizures in some people that are prone to seizures. So just like you get MSG in some of your food, it's a preservative, it's salt, but it's not good for you. So I don't recommend Ambrin. I would stick with something natural and stick with something that's an herbal treatment, and avoiding some of the triggers. So painful intercourse, there's a lot of non-hormonal options, and we do a lot of non-hormonal options for painful intercourse or vaginal dryness. Thermiva being one of them. And Thermiva is a radiofrequency treatment that actually stimulates hormone receptors, stimulates blood flow into your vaginal area. When you start getting receptors and blood flow into your vaginal area, you're actually thickening up the tissue that's in your vaginal. It's thin because you have low estrogen. It works over time. There are 3 treatments, but we've seen great results. And the best thing that we've seen is not only with vaginal dryness, but we're seeing a lot of positive results when it comes to incontinence. Intrarosa is another it's sort of a non-hormonal treatment. I call it pro-hormonal treatment. It's DHEA, which is a supplement that we end up supplementing our patients with, and we have supplements here for it, but it's a vaginal treatment that you use, a capsule you use once a month or once a day, and it stimulates your own estrogen, progesterone, and testosterone receptors in your vaginal area. Now, VFit is something that's pretty novel and pretty amazing, I think, because it's an at-home device. And it's red light therapy, and a lot of women don't know what red light therapy. In fact, I had to do research on red light therapy to see exactly what it was. But it's been around for over 50 years, and it actually works at the cellular level. So it's red light. It's not a laser. It's in a certain wavelength, and it stimulates deep into your cells to increase and generate cytochrome C oxidase and generate ATP, which I know is a little over your head, but ends up working over time. And that's an at-home treatment you do 3 times a week. It has heat attached to it, has the red light, and it has vibration. And a lot of women are reporting good results with that, and with incontinence as well. Of course, intercourse, I know we think a guy invented use it or lose it, but I think if he did, he was right at some point, because if you continue to have intercourse, you'll continue your own vaginal rejuvenation. If you think it hurts and you can't do it, and you don't do it maybe once or every 2 or 3 months, your symptoms will get a lot worse. Always remember to have your physician check your thyroid levels and your cortisol to make sure that they are not out of balance during this time as well. Exercise really is the key to a lot of symptoms and changing your DNA and your neurotransmitters. Exercise can help with depression, can help with stress and anxiety, and really works at the level of the brain. And of course, there's dietary changes that I've already talked about. Enter the heroes, I like to call them, the bioidentical hormones. And at our clinic, we promote bioidentical hormones. We want something that's natural to your body. We want something that's a safe dose and a safe delivery system. And bioidentical just means it is natural to your own body. So a lot of times you can say, well, I want something from a compounding pharmacy. You know, they can develop a prescription just for you of a combination of hormones. Or you can, if the insurance, insurance is always a problem, you can get a pharmaceutical bioidentical hormone that's usually just estradiol by itself. So the cast of replacement of bioidentical hormones, starring again, estrogen, progesterone, and testosterone. So estrogen, there are three types like we talked about: estradiol, estriol, and estrone. The functions in the body: estradiol is the main player. Estriol is a weaker sister, but has benefits, especially in the vaginal area. It has benefits in the colon, and it also has been shown to exert protective effects when it comes to the breast. Estrone, the bad sister, we don't like her. Testing for estrogen metabolites sometimes in your urine can help to see if you're one of the metabolizers that go into one of the precancerous pathways. We do that here, and it also can increase your risk of cancer if it's an abnormal form. Delivery should always be topical. Topical is the safest route for any estrogen, whether you're doing pellets, or whether you're doing patches or creams or gels. Pharmaceutical versus compounding. Compounding can actually personalize your choice of hormones. That is what you need for your body, and then make it more convenient for you. Pharmaceutical, for those that prefer to go that way, you're mainly going to get estradiol. So do you do estradiol biased? Well, that's a personal preference. A lot of times I will combine biased, which is estradiol and estriol together in a cream. And they usually have more estriol than estradiol, and a lot of patients feel more comfortable in that and feel like it works great. Other patients cannot. This is a purely individualized choice. So this is something that is a work in progress that we really need to take each person individually and figure out which is the best route, which is the best form, and the best, I guess, bang for your buck when it comes to hormones. A lot of times I'll do estradiol by itself and then an estriol vaginal cream, since they are the receptors in the vaginal area are for estriol mainly. And then pellet therapy. What are pellets? Well, pellets actually have been around for over 50 years until pharmaceutical companies got a hold of doing their Premerins and other forms of hormones down the road. Pellet therapy kind of went by the wayside. But now it's a natural bioidentical way to replace your hormones, estrogen and testosterone. And it's a little pellet that's inserted into the sub-Q area, lasts for 3 months. You don't have to worry about creams. You don't have to worry about pills, which I don't recommend anyway. And it lasts there, and it slowly dissolves over time. We check your levels and see when you're ready for the next one. Progesterone. We only use natural progesterone. Medroxyprogesterone, or Provera, like what it used to be called, is a very, very strong man-made hormone. That is dangerous. It actually works against your cardiac system and your blood vessels. And it's one of the hormones that were used in that WHI study where everybody got scared to death because of hormones, that and the Premerin. So when you're looking at studies and hormones, that's not a good one to look at unless you look at the revived results, because they went back and looked and did not prove that estrogen alone was causing the breast cancer. Must be taken with an estrogen unless you have a hysterectomy, then it's a personal choice, but we like to balance both of them. It does, when I say it's the peacemaker, it's the peaceful hormone. It helps with sleep and anxiety, so it's a good balance with estrogen. Can be topical, but oral is better if you'd like to sleep. Doses can range from anywhere from 50 milligrams to 200 milligrams. I'm really hesitant to go above 200 milligrams because I think patients can get really tired and fatigued the next day. Testosterone is just not for men anymore. Levels start declining in your 30s, since I've seen a lot of patients with absolutely no testosterone in their bodies in their 30s and 40s. So it's different for every every woman, and some have great levels up until they get into their 50s and 60s. Oral contraceptives and oral estrogen replacement can decrease the levels in your blood of testosterone. They can affect the liver to increase a certain protein called SHBG. When that protein goes up, it takes all your free testosterone and binds it up so it's no longer available. Women have 1/10 the level of testosterone in their bodies than men and have a peak in their 20s to 30s. Oral testosterone is proven to be toxic, and I really didn't know that there was still oral testosterone out there. It's a methyl testosterone, but that truly has been linked to breast cancer. Topical or pellets are preferred, and they are bioidentical. Injections are helpful, and a lot of women, we have a lot of patients that love their testosterone injections, but they are not bioidentical. So the good, the bad, and the ugly, the subplot, cancer and hormones. I think that's the main question I get every time a patient is considering hormones. Well, what's my risk of cancer? Well, I don't like to look at it like, what's my risk of cancer? Because number one, I don't believe a hormone replaced in your body that's natural, that's the right form and the right dose will cause cancer. However, you do have estrogen and progesterone, testosterone receptors in your body everywhere. And a lot of cancers have estrogen, progesterone, and especially in the breast receptors. So when you're giving a hormone and you've got that in your breast, it can cause a cancer to grow. That's why they say a lot of cancers that grow are with the hormones, but they're easier to find. And not that we want to give you estrogen and progesterone just to find a cancer, but to try to ease your mind that monitoring it and having the right doses is very, very important. So it's all quality of life. I mean, if you're miserable with hot flashes and you're miserable with a lot of other symptoms, and you want to improve your quality of life, hormones can help. However, I also say that quality of life is also not sitting there worrying about you are going to get cancer because you're on a hormone replacement therapy. So that's the main thing. You have to feel comfortable. You have to know what's going on out there as far as research and get something bioidentical. And I prefer topical hormones, and just, keep up with your mammograms and your breast examinations. So this is our first webinar, and we really appreciate everybody being here. So we have several sequels that will be coming to a webinar near you, because I know there's a lot of women out there dealing with polycystic ovarian syndrome, endometriosis, and fibroids. Also, polycystic ovarian syndrome can morph into metabolic syndrome later on in life. So it's something that you need to be aware of and treat when you're diagnosed with that. It also has pre-diabetic components to it. Thyroid function and adrenal fatigue, a whole other webinar that's a deep dive into what's going on with your thyroid, what's out there in literature, and how your adrenal gland plays in this, because this is sort of like a symphony. The thyroid's the big conductor. The adrenal glands and cortisol feed into this, and so do your hormones. So everything needs to be balanced out, and that's very important. And of course, we will have the horror sequel, Men, Hormones, and Andropause, because guess what, ladies? You're not in this alone. There is menopause for men, and that's called andropause. And thank God there are clinics out there now that are addressing it. They're talking about it. Men are more open to talking about their hormones as well. So if you're in a relationship, and the main thing is you want to be balanced in that relationship, you want to be able to be equal to your partner. So definitely talk to them. And sometimes, men are afraid to go to the doctor, but you can be their biggest champion in this point. So anyway, that's the end of my little movie of menopause or hormones. And I thank you very much for sharing your evening with us. And we thoroughly enjoy this. And please, let us know if you liked it. It was worthwhile listening to, and we will be happy to have more webinars down the road. Thank you. And cheers.